Homelessness is often seen as a social problem. Mental illness is often seen as a medical problem. But in truth, the two are deeply connected, each feeding the other in ways that create a vicious cycle. To understand homelessness, you must understand mental health. And to truly address mental illness, you must understand the crushing impact of homelessness. Today, let's go deep. Let's take an honest look at how mental health and homelessness trap millions in a cycle that is hard to break. And let's explore why compassion, treatment, housing, and policy must work together if we are ever to find a solution. The scope of the problem. Walk through any major city in the world and you will see it. People sleeping on sidewalks, tents under bridges, cardboard shelters tucked in alleys, the visible face of homelessness. But what you don't always see is the invisible struggle inside the mind. Depression, schizophrenia, PTSD, addiction, anxiety. According to studies, nearly 1/3 of people experiencing homelessness live with severe mental illness, and almost half live with some form of psychiatric condition or substance use disorder. These numbers aren't small outliers. They tell us something important. Mental health is not just part of homelessness. It is at the heart of it. How mental illness leads to homelessness. Let's begin with one direction of the cycle. How mental illness pushes people onto the streets. Mental illness can disrupt every part of life. It can make holding a job impossible. It can strain relationships until families fracture. It can cause behavior that landlords don't tolerate. It can drain money through medical costs and leave people unable to pay rent. Someone with schizophrenia may hear voices so disturbing that they can't keep steady work. Someone with bipolar disorder may go through manic spending that wipes out their savings. Someone with untreated depression may lose the energy even to manage daily responsibilities, bills, food, hygiene. Without strong support systems, untreated mental illness often snowballs into poverty, and poverty is a straight road to homelessness. How homelessness worsens mental health. Now let's look at the other side of the cycle. Once someone becomes homeless, their mental health is under siege. Imagine sleeping outside, exposed to weather, noise, danger. Imagine never knowing if tonight will be safe. Imagine carrying everything you own with no space to rest. This constant stress triggers the body's survival systems. Cortisol stays high. The nervous system never relaxes. Sleep becomes shallow, broken, or impossible. Over time, this damages both physical and mental health. Depression deepens. Anxiety becomes constant. Paranoia may emerge. People may turn to drugs or alcohol just to cope with the crushing reality of life on the streets. And those already living with schizophrenia or bipolar disorder often see their symptoms spiral out of control without access to medication or treatment. So homelessness does not just coexist with mental illness, it actively makes it worse. The role of trauma. To truly understand the cycle, we must talk about trauma. Many people experiencing homelessness have histories of childhood trauma, abuse, neglect, or instability. These early wounds increase vulnerability to mental illness in adulthood. And homelessness itself is traumatic. Violence, sexual assault, theft, humiliation, these are common experiences on the street. Each new trauma compounds the old ones. Each new scar makes recovery harder. And untreated trauma often leads people towards substances as a form of escape. So trauma is both a cause and a consequence of the vicious cycle. Substance use, coping, or catastrophe. Substance use is one of the most visible aspects of homelessness, and it is often judged harshly by the public. But here's the truth. For many, drugs or alcohol are not just vices. They are coping tools. They numb the cold. They soften the hunger. They quiet the voices. They make unbearable days survivable. Of course, over time, substances also destroy. They worsen mental illness. They damage physical health. They make finding and keeping housing even harder. And they feed stigma that blocks compassion. Addiction in homelessness is not simple indulgence. It is survival until it becomes catastrophe. Barriers to care. So why don't people just get help? The barriers are enormous. Access. Many have no insurance, no transportation, no way to reach clinics. Stigma. They fear being judged, dismissed, or criminalized. Trust. After years of neglect and rejection, trust in institutions is often broken. documentation, without ID or permanent address, even basic appointments become impossible. Fragmentation, mental health, housing, and addiction services are often separate when they need to be integrated. The result is that even when treatment exists, it rarely reaches those who need it most. The criminalization of mental illness and homelessness. Instead of treatment, many people experiencing homelessness encounter police, loitering, trespassing, public intoxication. Behaviors rooted in survival become crimes. Jails and prisons end up serving as psychiatric wards. But they are not designed for healing. They are revolving doors, releasing people back onto the street, sicker than before. This criminalization deepens the cycle. A criminal record makes jobs harder to get, housing harder to secure, and stigma even heavier. The housing first model. There is one approach that has shown promise: housing first. The idea is simple but radical. Provide stable housing first, without conditions. Then address mental health, addiction, and employment. Why? Because stability is the foundation of recovery. It is almost impossible to manage depression or schizophrenia when you don't know where you will sleep tonight. It is almost impossible to focus on therapy when hunger gnaws at you. Housing. First programs across the world have shown that when people are given shelter, their mental health outcomes improve. Their use of emergency services declines. Their chances of recovery rise. Housing is not just shelter, it is medicine. The role of society. We must also ask, what role does society play? Homelessness and mental illness thrive in the cracks of inequality. When housing costs soar beyond wages, when healthcare is inaccessible, when communities ignore the vulnerable, when stigma silences conversations. This is not just an individual problem, it is a collective one, and collective problems demand collective solutions. Breaking the vicious cycle. So how do we break the cycle? Early intervention. Treat mental illness before it pushes people into poverty. Affordable housing. Create safe places to live, especially for those at risk. Integrated services. Combine mental health, addiction treatment, and housing under one roof. Trauma-informed care. Recognize the wounds that drive both homelessness and mental illness. Decriminalization. Stop punishing survival behaviors and start offering support. Community support. Build networks of compassion, shelters, outreach, peer groups. Breaking the cycle requires both compassion and policy, both resources and respect, both prevention and long-term support. The human side behind every statistic is a person. A man who once had a job, a family, a dream. A woman who fled abuse and had nowhere to turn. A teenager whose mental illness was never diagnosed, never treated. When we walk past them on the street, it is easy to look away. But what we don't see is the depth of their pain. And what we don't always admit is how fragile the line is between us and them. A job loss, a medical bill, a mental health crisis. Many of us are closer to homelessness than we think. Closing. Plain but powerful. Mental health and homelessness form a vicious cycle. One feeds the other, trapping millions in suffering. But cycles are not destiny. With housing, with treatment, with compassion, with systemic change, the cycle can be broken. Homelessness is not just about lost homes. It is about lost stability, lost health, lost hope. And mental illness is not just about disordered minds. It is about a system that fails to care for them. Together, they form one of the most urgent challenges of our time. And until we treat them together as intertwined struggles, we will never truly solve either.